Good morning, Dan. That was weird.
Hey, no problem. Good morning. We are now live and getting recorded. I already have the agenda up, so no worries. Some people might be popping in a little bit late, not a problem. But there's just a few things I wanted to go over with everybody. I just want to start with a little bit of house cleaning really quick. All of these meetings and our the monthly newsletter is all on the DHS website. So if you miss a meeting or you want to go back because you missed something, if you go to the DHS website under our bureau, there's a tab called News, and under the News tab, all of this stuff is here. So it'll stay there basically forever, so you guys can see it. So with that being said, so you know where to find all the archived information, we're just gonna go ahead and say good morning and open this up. So the first thing I wanted to talk about, and I know just about every one of our meetings we talk about the psychomotor skills exams, since National Registry had sunsetted their piece of it. But I just wanted to let you guys know the way the rules are written. When they originally wrote them, they weren't expecting the National Registry to sunset that piece. And it threw a little bit of a wrench into the way our rules are actually set, right? Now, we cannot change the way the rules currently are. Now, in the future, sure, we can go back and look at how things are done. So within that realm, if we stay within the rules that we have to play by, it specifically states that a program can perform their own psychomotor skills exams and sign an attestation stating that all of their students have passed. Okay. Now I know there's some people that they don't like that because they don't want the program to be testing itself, no third party involvement, which I completely understand. And that's something we can work on in the future. Right now I'm working on just the form because that's the way the rule is set. It specifically states that you can sign an attestation on a department provided form. And I'm trying to create that form to make it nice and easy and kind of line things out. Like I said, I know there's a lot of discussion on, the fairness and validity of how certain programs are conducting their psychomotor skills exams. But until we actually get the rule itself changed, which is not going to happen overnight, there's nothing the state can do as far as dictating a third party coming in and proctoring the exam. Now, you're more than welcome as program directors to call in a third party or however you want to do it. And so basically what we have is two pathways to get the end result. So pathway number one is how you guys are currently doing it. You email me and I will email you a full testing packet, right? Now, at that point, it's up to you, the program directors, if you want a third party to come in and administer that, or if you want to administer the test that the state has given you, you're feel free to do that. The second pathway is you create your own scenarios and you're signing the attestation form stating that all of your students have passed. So that's where it sits right now. And like I said, I get it. I get the conflicts and all that kind of stuff on having, do we have a third party? This is how it should be. I get all that, and we can work towards changing that in the future, but we have to play by what's in the rule book as of right now today. Okay. So are there any questions around using the form and the attestation? If you want to, you don't have to, you can still email me and let me know which direction you're going to go. Let me back that up a second. Either way, either pathway that you currently go, you still need to email me and let me know which direction you're headed, because I would obviously need to email you the form, the attestation form, if you're going to go that way. But it also allows me to track the data and to see if a program is always using the state's scenarios or you're using your own scenarios. When we build up enough data, I can have concrete evidence on, hey, this program works, it doesn't work, how are we going to change it? And it gives us something to take back to the rule makers and say, hey, we need to actually add some things in here that says a third party needs to be involved, or however we want to break that down. But it's going to take time and data collection to be able to prove the direction we want to go. So with that said, does anybody have any questions?
Yeah, if I do, Joe Waterford here from Arizona Western. So when we do the adaptation and we do our own scenarios, what are the requirements that you're going to require what you want the scenarios to test or not to test?
That's what I'm putting in the form, right? So it mimics National Registry as far as the stations that you're looking for, right? So trauma, cardiac, integrated out of hospital, all of those categories. Now, what you're looking at within those categories is basically based upon the skills sheets that we used for National Registry. So that's what you should be building your scenarios off of.
All right. So then one more question. So timeline, can I do my psychomotor throughout the course when I'm doing my module testing? So when we complete airway and they take their written airway test, can we have the psychomotor part of that test, record it throughout the semester, so at the end of the semester, I can turn it in versus doing a 2-day psychomotor test?
So as current rule states, yes, that's not saying you cannot do it that way, right? You can certainly do it that way, unless the rule changes, because it's not, the rule is not dictating how you perform that. Is it in 1 day? Is it in 2 days? Is it throughout your semester? And how you want to actually get your students to pass in a positive direction for those particular stations. So it's not broken down as far as the rule states. I hope that answered your question.
Yep, that's all my questions. Thank you, sir.
Dan, I don't know if you saw in the chat, there's a question from Kevin, but it looks like you just answered it.
That's awesome, because I accidentally answered your question, Kevin, because I just now saw it, but excellent.
Yeah, I appreciate that. Thank you very much.
Mm-hmm. And like I said, I know the system that we're working in is not perfect. I get it. It's just, if we do want to head the direction, and that's why I bring it to our program directors, because you guys are the ones that have to utilize these tools. It's not me. I don't have to utilize them. I'm just the one trying to create them. And I'm trying to create them under the current rule set. If we want to change anything, again, like I said, we don't like the way this is working out, or maybe this system works out great and we're good. But if it doesn't, like I said, we need that data to be able to take to the education committee, to take to the medical directors, to take to all the rule makers, and get it changed to how we think it should be done. So that's the direction I'm heading with it. And really the direction we're heading is because that is how it is currently stated in rule. Are there any more questions out there about psychomotor skills forms? Hearing nothing. That's good news for me, that there's not too many questions. So it's pretty self-explanatory on how we're doing things. Number 2 is the EMR and critical care paramedic endorsement. There might be more questions on these ones, but both of these pieces go into effect in essence December 31st, 2024. So this year, at the end of the month, the EMR will now be in play, and the critical care paramedic endorsement. So let me just start with EMR. It's a very confusing, I can't even call it a certification, because the state of Arizona does not recognize EMR, the certification. The act of what an EMR can do, the state does recognize. But let me break it down on we'll just call it pathways, because everything is pathways these days. The way you can utilize an EMR within a program or within an industry. So in essence, there's, again, 2 ways to go about this. And there's some little caveats in between. But if your program wants to teach an EMR course, and you want your students to be able to take National Registry, you need to apply and become an official, authorized state of Arizona training center, just like you are at BLS, just like you are ALS. That application will go live December 31st. That is if you want your students to be able to take national registry. If you do not become a training center, you are still more than welcome to teach EMR under the authorization of your medical director. But understand, I cannot turn on from the state side their ability to take national registry. So they could become an EMR under that medical director and that medical director only. So for example, if a program went that way, let's say I work for ambulance company A and I'm an EMR under that medical director, and I don't want to work for that ambulance company anymore. I change to ambulance company number B. That EMR does not follow you unless it's the same medical director. I hope that's making sense, right? So one pathway, your medical director signs you off on the program. But like I said, unless you are an official Arizona Department of Health Services training center, I cannot turn on your ability to test for national registry. That kind of sort of makes sense, or not make sense, but that's the way the statute was written. So just another little caveat to that, just so people understand, the state does authorize and regulate the training center portion, but there is no state regulation or even an EMR certification for the state of Arizona. So that's where it gets a little sticky. If you want to know the backstory on why it's like that, again, I didn't write the legislation or the statutes or anything, but that title, EMR, is not included in the EMCT set of rules, right? So under EMCT, you have EMT, AAMT, paramedic, critical care paramedic. That's all there from the certification piece. EMR did not land in that subset. Only the training center did. So, like I said, if you want your students, if you're going to teach an EMR course and you want them to test for national registry, you need to become an official EMR training center with the state of Arizona for me to be able to turn that piece on. As far as EMR goes, any questions on that? Marissa, go ahead.
Sorry, I have a question.
Yeah.
Because people have asked this. You do recommend that the EMRs do get the national registry certification, or just register with national registry, right?
Correct. Yeah, that is the best route to go, because like I said, if you have that national registry piece, then you can go to different organizations, right? If you did it without national registry and you're only under the sole direction of the one medical director that signed you off, you have to stay under that medical director. So it is a good idea to make sure that your students pass or take the national registry to get their national registry certification.
Okay. And another part the second part of this question is, do you have any, or does the state have any plans to make this a certification? Do you know? And
currently, no, because we can't, we would have to get somebody to sponsor a bill to change the statute. And we as the state can't do that. Somebody else needs to, like, let's just say a medical director needs to step up and sponsor that bill to go through. We cannot start that bill process. We would like to, but we can't. Thank you. Any other questions on the EMR?
Yes, sir. So
Yeah.
you say we have to be a state certified training site for EMR. Is that separate from our current training site? And is that a separate application, or is it, we just add it to our current status?
It's another application. So I know you're a BLS training center and an ALS training center. On December 31st, that application goes live to where you would have to get online and apply to add the EMR to your training center.
Thank you.
You're welcome. If there are no other questions on EMRs, we will jump to the critical care paramedic endorsement. And again, this is another one that can take two pathways on how you actually get there. So we'll just, I don't want to say the easiest one, but so this again is another one of those things where if you want to teach critical care paramedic as an authorized state of Arizona training center, just like EMR, you would have to apply and become a training center for the state of Arizona. With that said, you do not have to become a training center within the state of Arizona. You can teach your own critical care paramedic program on your own without the state's backing. There's two pieces to that. If you are a training center authorized by the state of Arizona, there's a certain rule set that you have to follow, meaning minimum number of hours. It's 200 hours in total, 135 didactic, and then it breaks it down into clinical hours and all that kind of stuff. If you become a training center, you must follow that rule set. If you decide, let me back that one up. When you're an Arizona training center, you follow that rule set. Your end result, right? When the students pass your course, they need to sit for and take one of the national certified critical care exams, meaning the flight paramedic exam or the other one, I forget its name, the Board of Critical Care Transport, that really long one. But the end result needs to be a national critical care paramedic certification. Like I said, I'm very familiar with the FPC. That's why I always fall back on that one, but there's a couple other ones, right? So your end result of your training center is they need to be able to sit and pass for that. If you do not want to become a state authorized training center, you can still teach your critical care paramedic course however you want, however many hours, however many clinicals, how much clinical time. The end result of your own class still needs to be they sit for one of those national critical care exams. So you can take two pathways there. There is another little tiny caveat to that. If you are smart enough to not take any schooling whatsoever, read the book and go sit by yourself and take one of the national exams, and you pass an FPC, you can apply for your endorsement. If you currently have one of the national recognized critical care paramedic certifications, you don't need to do anything. You already have the national certification. So I'm going to say December 31st is when it turns on, January 1st, whichever day, you can apply for that endorsement. With all of that said, is there any questions on getting your critical care paramedic endorsement or having a training center with it?
Hey, Dan, I have a quick question for you, just kind of about the training center stuff.
Yes.
And also relating to the certifications required there. So my first question was the language. So I see Marissa just posted that IBSC website so that the transport, just so I'm clear, so you can have your FPC or your CCPC to initially apply already. Is that correct?
That's correct.
So that the BCC TPC is a subsidiary of the IBSC. So there's no certifications that would come through that are from technically the BCC TPC. It would all come through the IBSC. So that language is just a little bit confusing, I think, for kind of how it's written at the moment. So follow up to that, would like a CCEMTP certification from another college, let's say outside of the state, then also count for that certification?
Yes, that's my understanding. And the only reason I use those two, the FPC and the BBC one, is because that's what the medical directors wrote in all the literature that they're pushing out.
Okay.
But like I said, that all the stuff that you just mentioned is absolutely appropriate as well.
Okay. Now, as a training center, you mentioned if you want to go through as the state, obviously you can submit that application. Is there any accreditation that has to come with that as well?
Do you mean like a COIMS accreditation or things like that?
Yeah.
Not as of today, no. So if you wanted to start a training center, there's no other accreditations with that.
So I work for the University of Arizona. I work with Dr. Rice with our critical care paramedic program. So that was kind of some of the questions that we had, just to make sure that we're following under the state circumstances there. So
Right.
just as is, so long as, if we're just going to follow those rules, it's just written as such, then we should be good to go, so long as we're following the minimum hours.
Correct. And we're following up on some of your questions actually with Dr. Bradley, and Dr. Rice and Dr. Bradley are supposed to have a discussion on exactly everything that's going on.
Awesome. Thank you so much, Dan. Appreciate it.
You're welcome. Any other questions out there on critical care paramedic endorsements? Awesome. You guys are making my life easier today. So that's really the two things that I wanted to talk about, because that's kind of the hot topic right now. I'm pretty sure all of you are getting the newsletters I'm sending out bi-monthly. Hopefully there's some information in there that you seem helpful. If not, let me know. The next edition will come out in February. If there's anything that you want to see in those newsletters, information that you think would be helpful to the rest of Arizona and the rest of the program directors, let me know, so we can all start getting on the same page and talking with each other, letting everybody know, hey, I tried, this route, it didn't work for me. Just getting everybody in the programs to start talking and kind of getting on the same page with what we're doing. So if you have any requests for future content of the newsletter, please let me know. Other than that, unless you guys have questions on anything else, we can be done for today. And our next meeting is, hang on one second. My STR plan, I don't want to say it's on hold, but it's on the back burner for the moment until we get everything pushed out as far as the critical care and the EMR and all that kind of stuff. So I haven't forgotten about all the STR stuff and updating all those kind of things, but it's one of those things that keeps getting pushed back for other things. Like I said, I would like to start looking at revamping the whole STR, call it program, everything that goes with it. I'd like to start getting everybody's information put together. I wanted to start that in January. We'll see how everything goes. Just so everybody understands, there's a lot of moving pieces right now in the Bureau. As you guys may or may not know, our Bureau Chief's last day is actually today. So we're going to be running without a Bureau Chief for a little bit. And there's some other vacancies at the state. So we're all kind of working double duty. So some things like the STRs might get pushed back just a little bit. Thank you for the question, though. Our next meeting is going to be in February, so February 21, same time. I'll send out reminders and stuff like that with the link and all those kind of things. So if you guys don't have any further questions, we'll go ahead and adjourn this one. And as always, feel free to email me, text me, all those kind of questions if you need anything. If nobody has anything, we'll go ahead and call it a day. Thank you so much.
Dan, I have a question.
Oh, go ahead.
Sorry. So I'm glad you answered the STR question. I've been getting that question. Also, I've been hearing people ask for, do we know if we are going to post new drug profiles for the critical care meds that are being added?
I'm not sure. We should be, but I'm not sure where we're at in that process. I can ask Dr. Bradley later today.
Okay. And then the other question is, so you mentioned you can just go sit for the exam and get your FPC or CCPC. Yeah. But will there be a requirement sometime soon that the paramedic looking for the endorsement actually do some clinical time?
The way it's written, you technically, you don't have to. I could just go sit for the exam, and if I pass it, then I pass it.
Okay, and that's gonna stick, you think, for a while?
I think until it works its way out. Yeah.
Okay. Perfect, thank you.
You're welcome. Any other questions out there? Excellent. Well, you guys have a great day and happy holidays. Take care, and we'll see you next year.
Hey, Dan.